The spine is designed to move. It flexes, absorbs load, dampens shock, and adapts constantly. Yet for decades, our primary surgical solution has been to stop it from moving. That contradiction sits at the center of modern spine surgery, and it explains why so many patients, and frankly many physicians, still feel uneasy about long-term outcomes. Why fusion became the standard. Fusion wasn't a mistake. It emerged at a time when instability and pain left surgeons with limited, imperfect options. Fusion brought predictability. It reduced motion at a painful level and, in many cases, relieved symptoms. Over time, that predictability became comfort, and comfort became convention. But conventions don't evolve on their own. The cost of convention. The spine doesn't stop functioning because we fuse one level. It redistributes load. When motion is eliminated at one segment, adjacent segments absorb that stress. Clinically, we see this as adjacent segment degeneration. This isn't a complication of poor surgery. It's a predictable consequence of biomechanics. Why other specialties evolved. When we look at cardiology, orthopedics, or plastic surgery, the contrast is striking. Those fields moved away from rigid, invasive solutions toward preserving function and confidence. Not because surgeons became less skilled, but because philosophy changed. The question is why spine surgery, despite its sophistication, remained anchored to rigidity. The real tension. The spine is not a mechanical structure. It's viscoelastic. It absorbs force over time. It behaves differently under slow loads versus sudden impact. So when we treat it like a fixed hinge, we create a mismatch between biology and mechanics. And this mismatch shows up, not immediately, but years later. So the real question isn't whether fusion works. It's whether stopping motion should remain the endpoint of innovation in a system designed to move. At AxioMed, this question guided everything we built. We focused on designing a disc that behaves like a natural disc, viscoelastic, load-absorbing, and motion-preserving. Today, we are raising capital to bring the AxioMed disc to patients at scale, commercializing the lumbar disc in the US in 2026, expanding globally. Our goal is not to replace one device with another, but to move spine surgery forward, from rigidity and fear toward motion, confidence, and longevity.